med school years, I was always fascinated with how the immune system works in our body. So, doctor, what are your views on the immune system and immunity as in general?
Immunity is the ability of our body to withstand or react or respond to a attack from a bacteria, virus, or a pathogen. So it's basically of two types: active and passive. Active immunity is something which is inborn, which we inherit during our birth, and passive immunity is acquired from outside or through vaccination or other types. So in case of an active immunity, uh, most of the people have immunity to a certain level of conditions. uh, when there is no such response, diseases start to easily attack us, virus start to attack us. In case of passive immunity, people who have low immune response, we induce immunity by injecting or giving vaccinations. And also, another way of passive immunization is getting immunity from the mother through the placenta naturally. Yeah.
Doctor, would you like to add something?
Yes, in active immunity, it is very cell line structures is there. So, in a simple words, we can see that there is so much of white blood cells that is responsible for this immune mechanism and all. But there is neutrophils, eosinophils, basophils, so much of white blood cells that is responsible for the immunity proper functioning and all. But in some cases, there will be a depreciation in this fighting against the antigen, because body is very prone to diseases. Each and every minute and seconds, it is a microorganism is try to invade the body. But our immune mechanism, it is defending each and every time. In that structure, our skin is the first thing, because in line there is so much of structures like livers, pancreas, so much of soft organs is there. It is very susceptible to immunity. But according to that, over that there is a covering like a skin. So skin is the first and baseline of the structure, that is barrier for this immunity and all, to correct that. So this is the first line of defense. Second thing is, there is some microorganism that will enter to our body. There will be a response from the memory cells, T cells. So that will give a memory to the immune system. So there will be a antibody will be created inside the body, and that will persist inside the body. So for example, there is chicken pox. Once we are susceptible to chicken pox, there will be antibody already created inside the body. So again, there will be any attack from the chickenpox viruses, automatically this immune system will defend and they will protect from that organisms to our body. So this is the two type of immunity already doctor said about that. And there is some conditions that will be depreciation of this mechanism will happen. So that is known as immunity deficiency. So that causes diseases or conditions. So much of factors is there to depreciate. One is there will be any type of drugs that we are overusing, certain type of antibiotics like that. Some drug induces, some alcoholism, some type of synthetic foods, and according to the climate, lead poison, so much of conditions that will aggravate or depreciate this type of immunity responses. That causes some conditions or diseases regarding to specific to the body or otherwise to certain organs also. So that we have to manage with some medications or some diet or some other vitamins to supplement accordingly.
In Ayurveda, what type of drugs or what do you recommend for improving immunity?
During the COVID period, you would have seen immunity was the prime focus for everyone. So, for immunity, the central government had released Ayurveda many drugs, which primarily include basic herbs which we use in our kitchen or which is found in our garden. It includes tulasi, turmeric, and black pepper, ginger, so cinnamon, garlic. So these things all actually improve our immune response. Actually, it doesn't improve the immune response. It builds our body to fight the pathogens, so that the body will gradually improve the production of the WBC T cells and all. And also, our lifestyle is a very important factor. A healthy lifestyle can actually improve the immune response of a person.
Like
Proper diet is very important, and also proper exercise, physical activities, less stress. All these factors also involved.
Anything you would like to add?
Yes, and there is a, already I told about that, there is a generalized immunity. We have some medication to improve the generalized immunity and all. But there is some specific immunity we want for some type of organs also. For example, if we have wanted some immunity related to bone and joints, we want to prefer ashwagandha more. That is amukura more. In Siddha terms, it is amukura more. If you want a respiratory wellness or you have to increase immunity like that, we want this dipyliresinam is very good for that medication. And we want to improve the skin and all, the eladishurnam like medication will be improve the immunity regarding that also. And so this is the specific medications that we want, because each and every organs will be a specific immunity response medicines will be there that we have to add, because it is not as like allopathic medication. It is not directly involved with the production of antibodies or we are replacing the antibodies, but it is acting for that type of cells that it is increasing the response with the bloods, so that will improve the quality and functions of that cells that will creating these antibodies and all. So it is like a rejuvenation, everything. So in our concept, the rejuvenation is the main thing. When the one cells is started decreasing its functions only, this is one of the factor of immunity depreciation. So we will improve that rejuvenation functions of the particular organs. For example, there is a medicine in Santhigiri, the Balasarvangam. It is a very good immunomodulator regarding the respiratory as well as the nerve functions. So we are continuously giving that. Even in the COVID period also, it is a very good immunomodulator to resist against or resist it to some extent for this COVID inflammations and all. So that is clinically proved. There is a research paper is there. So that is the one of the, this is the type of immunity. But general there is a thing, and even organ specific is also there.
Okay. In Ayurveda, can you suggest some medications like that?
Indugantham kashayam, Indugantham formula, which can be used as kashaya, which can be used as pana. Pana means we can just boil and drink. You can make syrup out of it. You can make ghee out of it. So Indugantha is one of the prime medicine which can be used for increasing the immunity, especially in cases of pediatric. So in pediatric cases, Indugantha kashaya or Indugantha combinations along with Swarnaprasha. Swarnaprasha is giving gold preparation, micronized gold mixed with herbs, which can be given once a month for children, pediatric cases. From usually we give even from birth itself we can give. In earlier days we used to give Vayambu, that is Vacha or Akoris, along with Swarna, gold, for the kids after our birth. After the 28th day we used to give it. Nowadays those practices are not properly followed, and which also I think affects the immune response of the kids.
So, shield yourselves internally and externally. Immunity matters, so take control.